Okay, so now after we understood why the cranial system is so important, now I'm going to explain what is ICS. Okay? So this is a Gal. Gal is an osteopath and a medical doctor who specializes in family medicine. This is Tal, he's an osteopath. This is Adva, my wife, and this is Erez. She's running the training center. And so ICS is a new method of working and balancing the cranial system. Okay? It's a new way to look at the system. Okay? And one of its base is the philosophy of osteopathy. Okay? And the reason is, in Sutherland books, he said all the time, all the cranial work that I did, the credit is for Steele. Everything that I took from Steele. You cannot understand anything in cranial cycle if you don't understand how Steele was thinking. And this is the reason why I teach my students how to think. Not memorize. I'm going in the footsteps of Steele and Sutherland, that they ask their student to think, to reason, to know anatomy, and to use the philosophy of Steele as the base of their treatment. It is not like a lip service, it's not just you say it, no, you really mean it. And this thing has a lot of significance in the way I'm working and the way I'm presenting the method. Because I believe that the principles that Steele gave are universal. And now I'm asking, who is in phase 2? Okay, and when you will find the liver or L5 or whatever vertebra, you see that the cranial will get balanced, and this is how I know where I need to treat. The tissue that is going to balance the cranial system, this is the tissue that I need to work, and this is the tissue that's going to balance all the homeostasis of the body. Okay? This is very important. Okay? So the goal is to find the source that prevents the body to heal himself. Okay? And I want to do one thing that changes everything. Okay? Now, how I do it? In ICS, we have 5 different ways of touching. So when I'm touching, let's say, we have the muscle, the bone, the dura, the fluid, and the brain. Every of these structure has a different texture, different feeling, right? And every layer has a different pressure. The more I want to go more deep, I need to press more. Yes? So when I'm touching the frontal bone, for example, I want to feel the frontalis muscle. And then it has a certain texture to a muscle, right? To a contracted muscle. And then the bone has a different texture. And then the dura has a different texture. And the fluid and the brain. So what I'm doing in ICS, I'm going to diagnose the system, the cranial system, according to these 5 layers. And I'm going to tell you in which layer I'm going to have a dysfunction. Because one of the things that was really troubling me, I got a lot of techniques to work on the fluid, on the skull, on the suture, but when do I do it? How do I know which technique to use? Because the technique for the bone is different from the technique for the fluid. And for the dura, everyone is different technique to how do you choose. So I need a method to choose. And what we do in ICS, I ask my student, tell me which layer is stuck. And after you know which layer is stuck, every layer has a different connection. For example, the dura is part of the fascial system, right? It's part of the fascia. It's the fascia of the brain. The fluid is connected to the diaphragm, the movement of the fluid in the body, to the pressure in the cavities. So every kind of dysfunction I see in the cranial send me to different places, because think, you need to take into consideration all the system of the body. So how you start to take down, eliminate all kind of system. You do it according to the layer that is dysfunctional. Okay, so when I'm going to tell you there is a dysfunction in the cranial system, I will tell you which suture, I will tell you which part of the dura, I will tell you which fiber in the dura is stuck, not only which part of the dura. When I will tell you there is a problem in the fluid, I will tell you which blood vessel is stuck, which ventricle is stuck, and I will show you direct connection to the other part of the body. And now this diagnosis that I use for the cranial, I'm using to all the rest of the body. So when I'm touching the spine, ask my friend, what are you treating when you are treating the spine? The muscle? The facet joint? The muscle is the multifidus and the rectus spines that can create spinal dysfunction. The facet joint can get out of balance, right? The dura can hold it. The CSF and the spinal cord itself. So when I'm touching the spine and I see a vertebra is in dysfunction, I will tell you which layer is dysfunctional, because every layer has a different technique. Okay? And this I will do to all the body. When I see a shoulder problem, I want to know, is it a muscle dysfunction? Maybe a joint dysfunction? Maybe a fascial dysfunction? Maybe the lymph here is dysfunction? What is the problem? What I need to work on? And this is what gives me the precise, that I know exactly on which tissue I'm going to work, and I know where it is, and I know what to do. It's not in general, I'm working on the shoulder. No. I'm going to tell you which fascia, I'm going to tell you which blood vessel I'm going to work on. And this is what gives me the result, that I know exactly what to do, and I have a method of diagnosis. Okay? So this aspect of treating here, the 5 layer, is not only for the cranium, it's for all of the body. Okay? So what we do in ICS, because in my beginning I was very skeptical about all this gentle touch, because remember, I used to do a lot of the mechanical stuff. I also taught it a little bit. I said, how do I know that it's really working? Maybe I'm deluding myself. So everything has a test. And then you do the technique, and then you check the test. And now, what we did in ICS, we created a lot of chain. A lot of dozens of chain. Every chain is a different structure, like muscle, nerve, fascia. Okay? And when I see like a pattern in the cranial system, it always creates a chain reaction. And I know this chain reaction in advance. And I know in advance which fascia is going to stack, which vertebra is going to stack, which inner organ is going to stack, and I know which tissue is going to get contracted. So if I will tell something, if I say, okay, I think the pattern is like X, I have to see A, B, C, D, E get contracted. And after I release, I want to see all of them also get released. But if I see a pattern in the cranial base, all of the other links also can create this. This is how I know where to go. So the treatment is not subjective, that I say, oh, I feel that it's getting better. No. I want to see all the bodies changing. And I know in advance where to look. And this is what gives me the confidence that I succeeded. Because I was very skeptical. And I didn't know if I'm going on the right route. How do you ask me? How do I know that I'm doing the right technique that for the patient? How do I know what is the compensation and what is the source? I didn't have an answer. How do I know what is the compensation? And in this way, I know what is the compensation. Because if I work on the source, all of the compensation disappears in the same second. Because all this compensation happened because of initial imbalance. And when you release the initial imbalance, all the body, the same second, gets released. Okay? And the thing is that is objective, because if all of us will do the same test, all of us will get the same result. There is only one answer correct. There's no true answer correct. And this is things that create a lot of stability. And I have a lot of Chinese acupuncture in my courses, and for them, if they do a diagnosis, everyone says a different thing. And this helps them to find confidence in their treatment, that they're going in the right direction. I have to tell you, I do a lot of mistakes. But when I do a mistake, I know I do a mistake. I'm going to a different route, and it's happening in the treatment. I think this is the way I need to go. I have an idea how to approach the body, and I say, no, that doesn't work. So I go to a different route. I can check, I can look at the body in so many angles. And this is how I know which angle is the correct one. I'm not forcing myself on the patient. And in this way, I know if I'm on the correct path or not. Okay? And this is why you'll see I have a lot of confidence, because I know exactly what I'm doing, and I know the results that are going to happen after every technique. And in my treatment, you can say, oh, Isaac, I do 3 or 4 or 5 techniques in treatment. I don't do a lot. The diagnosis, this is what is important. Okay? I just tick, 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 tick. The body gets balanced, now go home and tell me what happened. Okay, one of the things that I did in ICS, I don't need to invent the wheel from the beginning. I use a lot of theories that already existed. This is a theory of a chiropractor named Lovett that talk about the connection between the sphenoid and the coccyx, the occiput and the sacrum, C1 and L5 and so on and so on. And this very correspond to Sutherland theory. Okay? So I use other theories that already exist, and all this theory finish in this call. I use them in a different way. Okay? I just use them as an inspiration. Okay? Here you can press another one. This is Tom Myers, so I'm sure you know him. You see, this is the back line, but where it's finished? In the gala poniotica. So I can have someone with a hip problem, and he has a limitation in hip flexion, and I'm balancing the muscular layer of the cranium, that this is the galea, and you'll see that he can lift his leg. Okay? Because you need to remember, all the layer can get dysfunctional. The muscle can get dysfunctional, the joint can get dysfunctional, the fascia can get dysfunctional, the fluid can get dysfunctional, and the organ itself can get dysfunctional. This is the reason why there is a space for everything. There is a space for deep tissue, there is a space for mobilization and adjustment, there is a place for like unwinding and a lot of indirect. The question is when you do it. When you do it, this is the answer that I need to, I had an answer it, because of the fact that chiropractic work and also massage therapy work. When the problem is mechanical, when the problem is muscular, you do dry needling, you do trigger point, it will heal the person, because his problem is muscular. And what we do in ICS, I want to know, okay, tell me what tissue is dysfunctional. And you don't need to use my technique. I can show you my technique, how I balance in the facet joint. But if you want to do adjustment, do adjustment. Doesn't matter. And if you want to do massage for the muscle. But I can show you my technique, how I work on the muscle, that I think it's much easier, but it doesn't contradict what you are doing in your massage therapy. I'm just asking you to, if someone comes with a problem, check what tissue is the problem. Because if I'm a massage therapist, everything is muscle. But no. If I'm an osteopath that do adjustment and mobilization, everything is mechanical, like a joint problem. And then you are very narrow. You narrow yourself. Okay? So in ICS, I'm working on all this level. This is why everything that you learned already is great. You can use it. It doesn't contradict everything that you learned. You understand? Okay. And this is from Littlejohn. He's an osteopath, British. that, you see, this is the line forces that come from the cranium to a certain vertebra. And I took this, I don't treat the forces of little John like I learned in the osteopathic school. I just use it in a different way. You understand? So I took a lot of other theory as an inspiration. And then I created a lot of my own chain, my own interaction. And all this helped to explain how the body works as a unified way, in a chain. Okay? So the fact that I see contraction, I don't treat it. I say, why it's contracted? Why the joint is not balanced? I always ask why until to a place I don't have any room. And I want to tell you one more thing. The purpose in ICS is a diagnosis. Okay? And sometimes the inner organs are in dysfunction because of a bad lifestyle. People are drinking alcohol, eating bad food, McDonald's and all this fast food, smoking. Everyone, there is someone here smoking? No? And this is what creates a problem. And I should show my patient that they're smoking, that their neck problem is because of their smoking. How I do it, I just give them one technique for the lungs and I show them that the range of motion is much better and the pain will almost disappear. And then I give them a choice. You see, your pain in the neck is because of the lung. If you continue to smoke, it's not going to pass. You need to continue, you need to stop smoking. And this is your choice. I just show him the why. And this is the reason why a lot of people change their life habits, their lifestyle because of this treatment. Because I show them direct link between what they do and their complaint. They don't necessarily understand the connection between their bad foods that they're eating and the lower back. But I give one treatment to the intestine and the lower back disappears. And I tell them, listen, if you continue to eat McDonald's every day and pizza, it's not going to disappear. You need to go to a naturopath to give you a decent diet. So you need to understand it's not up to you to solve everything. Okay? Sometimes you need to take them to send them to a naturopath. Sometimes there are a lot of people who work on computer, so they have a very poor muscle strength. They need to go to Pilates or yoga. But you need to diagnose it, that they have weakness in the muscle. Some people ask me, some people have emotional problem, and this creates them the pain. So how do you know? What do you do with this? So in ICS, I personally don't treat emotional disorder. It's my own decision. I was not trained for treating emotional disorder. But if you train, you're welcome to do it. But I can diagnose that the patient complains, the source is emotion. How I do it? I see that the ligaments of the pericard are contracted. And when I do one technique for the ligaments of the pericard, and the pain disappears, I tell the person, you see, I just released the ligaments of your pericard and you don't have pain. It's emotional. Unless you had a heart operation, the ligaments of the pericard should not be dysfunctional. And then I said them, you don't need me. You need a psychotherapist. And most of them trust me and they do it. And this is how I get healing, because it's not what I'm doing, it's the body, and sometimes the patient need to do other stuff. He need to, if he will do the same thing, he will get the same results. So he need to change. And the one way that I saw that some people are willing to change is when I show them the direct link between what they do and their pain. And then I have a lot of satisfaction, personal. That people stop smoking, start to eating good, start to exercise. And this is what gives the healing. Remember, it's not I'm the best osteopath or chiropractor, I give the best adjustment, here you go. No, it's much deeper. a lot of the time the patient needs to change his habit. You need to change the inner environment. And then when all this happens, healing happens and the pain doesn't come back. And this is what ICS. First, ICS is a method of diagnosis. This is why I created the diagnosis, because I was confused. I was missing. I asked why, I didn't know. And now I know. And now I'm going to show you. Okay, now if you have a question, feel free to ask.